Good morning. Thanks as always to Jay and Vicky for interpreting for us this morning. So in some respects, as we've noted in previous weeks, the battle against COVID-19 is going better. Our numbers continue to decline when it comes to positive cases and hospitalizations, bolstered by increased vaccinations, and the cold weather, I think, is keeping people inside and keeping people from gathering. So that's good news. So let's run through the numbers. The total positive cases in Hamilton County as of today stand at 69,858. Hospitalizations stand at 2,481. The death count is up to 487. So the increases, as you all know, I keep increases week over week. So when it comes to positive cases, the increase since last week is 2,086. In hospitalizations, it's 43. And in deaths, it's 27. Now, for those of you that have been keeping track of this, that number is very high. I've got my list, and to give that some perspective, over the last few weeks, the death number, the increase week over week was 4. Then the next week it was 15 in early January, then 14. Last week it was 5. This week it's 27. We haven't been in the 20s since June. So I've talked to Greg Kesterman about this as to why that number is so high, and I'll let him illuminate a little bit, but the death count, as we know, is a lagging indicator. And so we think this is perhaps an indication that people did get together in some cases over the holidays, and they've been, they caught COVID, they were in the hospital, and now many folks have passed away. So it's really kind of disconcerting when you look at that number. But again, I'll let Greg talk a little bit more to that change in that increase. So on a positive note, 78,698 people have taken their first shot, their first vaccination. That represents 9.63% of our population. So almost 10% of the population has gotten their first vaccination. So we've got something, I don't know if we've got the graph available, but by way of the population and the, there it is, thank you, the age range. So of those that are 80 and over, 56%, 57% have gotten their first shot. In the age range 70 to 79, about 37% have gotten their vaccination, first shot. 60 to 69, and remember, 65 and older are eligible, 60 to 65 are not yet, but that percentage is around 8%, and then you can see it gets lower as people get younger. The ones that are captured in those categories that are younger and not eligible by age yet are obviously some of the hospital workers, the healthcare workers, teachers. They're captured in that data. So I think it's really interesting to see this and see how many of particularly the very senior people in our community are being vaccinated. So I think that is actually a good sign. Today, Craig will provide more context on the numbers. Also, we're going to be joined by my colleague, Vice President Alicia Reese, with an update from the Economic Recovery and Relief Task Force. And finally, Assistant County Administrator Holly Chrisman will be here to give an update on the administration's recommendations for the CARES Act funding. As a refresher, and we did go through some of this yesterday at our meeting, the federal government gave us $142 million last year for our COVID-19 response here in Hamilton County. So we used a lot of those dollars to increase testing, to help staff up public health, to provide critical relief for small businesses, for renters, nonprofits, and there were a number of other initiatives that we have detailed in the past. So remember, the deadline for spending those dollars originally was at the end of the year. We did get an extension, and so, which was great. So some of the dollars that were kind of there at the end of the year are then continuing on for some of the services that were already being provided, and some of it's being reprogrammed. So Holly Chrisman is going to detail that. And what we're trying to do here is continue to hit the mark, right? Hit the need in the community. So we've got 6.65 million for new programming, and that's what Holly is going to talk about. What we know is that there are still people struggling in the community, and we need to make sure that we are providing those resources as needed, and in priority order. So small businesses is on the list, food security is on the list, and you'll see as Holly details that. And so I view some of the CARES Act funding, the federal relief, really in three different buckets. As you know, we've got one bucket moving through right now where the federal government is talking about additional relief for local communities. We are watching that closely. Nothing definitive yet, but we are hopeful that we'll get an additional allocation, and that it'll be a direct distribution so we can use those dollars as quickly as possible. There's another pot of money, it's about 15 million, that is being provided directly to the county for rent assistance. And so we are planning to use JFS to distribute those dollars. And so again, Holly will detail that a little bit. And then this extra 6.65 is being reprogrammed. So kind of a high level, three buckets of what we're talking about related to CARES Act funding and federal relief. So I am going to stop there and turn it over to Vice President Alicia Reese for an update on the task force.
Thank you very much. And Commissioner Driehaus, you had my talking points. So let me say that the Economic Recovery and Relief Task Force, the goal is to deal with the economic part of dealing with COVID. So that's the area that we're focused on. So when Holly comes up and talks about what's going to be recommended to the board, obviously the board, and I'm a member of the board, the three of us will make a decision where we put those dollars. But I want to be clear that the Economic Recovery Relief Task Force is not a separate entity on the side. It is a part of helping to lead and make sure that we distribute and be able to get the resources to people quickly. We have two phases of the task force, just as a quick refresher. The first phase, which is the phase that we're in now, is the internal strike force. So that is working internally with the administration, with a team to get the dollars out, but also working with other entities that we will be meeting with. We'll be meeting with the treasurer. We did meet with the current treasurer. We'll be meeting with the incoming treasurer, because we're looking at how do we reduce taxes, how do we reduce the ratepayers as it relates to MSD and other things. We'll be bringing in other executive branches in to see how we can help provide relief. Our county, like anybody else around the country, we are in an economic 911. We are also dealing with a health crisis as well at the same time. And so the Economic Relief and Recovery Task Force goal is to build on those dollars that we have left, but also look at policies, also look at what other dollars that we could compete with. The governor has a budget now. We want to make sure Hamilton County gets our fair share. We're going to be competing with 87 other counties. So the task force allows us to position ourselves to be ready to go with a plan to compete for those dollars. We have a new administration with President Joe Biden and Vice President Kamala Harris. They have a budget and funding for money. We want to be in those conversations as well. And so by us having the Hamilton County COVID-19 Economic Recovery and Relief Task Force in place, it positions us in a better position to fight for those dollars. Phase two, once we have gotten people stabilized, will be an external group that will look at the rebuilding of Hamilton County. Where do we go from here once we get past COVID? How do we invest in the right things? How do we make sure that we've got affordable housing countywide? How do we invest in the right economic development? How do we reopen and make sure these businesses are being able to sustain? That will be phase two of the task force. One of the things that we also are looking at, we have also we're doing a SWOT analysis on things that we did strongly because the money came in so quickly, and the group did a great job of getting the money as quickly as possible to people. But now we have a chance to kind of step back and say, okay, what are some things that, listening to residents, that we can improve on? We will be having a one-stop portal that we're working on right now that will be announced very soon. We've already started working on it. And pulled the group together, and that will be a one-stop where you can go there, you can get the information, and help you really navigate the process, even from a mobile component. Secondly, we will also have, we're recommending navigators, and you'll hear Holly talk about that a little bit later, but navigators that people can pick up a phone and talk to someone. And so we see right now that there has been a bottleneck. In other words, we have the money, but maybe the capacity. In some of the agencies that we have funded, there may be a capacity issue. So we have people that are ready to go. We have the money ready to go, but they haven't been processed yet. And so they have to get processed because the bills are due. And so we recognize that, and we're looking at having navigators that are ready to go to help us with the capacity issue as it relates to our economic recovery. Hamilton County, as mentioned earlier, we have received the $15 million from the U.S. Treasury, and we decided that it's going to go in-house through Jobs and Family Services because we feel that that's the best way we can measure it. We could have capacity, and we'll be able to get the direct help to the people. The criteria. You have to have at least one member that qualifies for unemployment or has experienced a reduction in household income, incurred significant costs, or experienced a financial hardship due to COVID-19. That sounds very familiar. We got a lot of people that will qualify. Or two, demonstrate a risk of experiencing homelessness or housing instability. We know that that is there. The third criteria is have a household income at or below 80% of the area median income. And so the city and CIA also have allocations that we are actively coordinating with. It's very important that we coordinate. To the residents, they live in Hamilton County. I mean, they don't understand the silos. So we're working together collectively for one Hamilton County. That's why we want to have our one-stop up and available. We want to make sure the agencies that we do fund have capacity. We don't want to give money and then they don't have the capacity for the demand. So we're looking at how do we help them with capacity so we could get more people through the pipeline and release the bottleneck that is happening currently. We have already helped 3,010 families as it relates to this, but we know more has to be done. We also understand that there will be a gap we've got the funding from the Treasury. JFS is getting up, ready to go, trying to get all of the things that we need for capacity, but there's a gap there. And we want to assure you that while we may not be ready for the 15 million to go today or tomorrow, I wanted to make sure, and commissioners wanted to make sure, that we didn't lose people in the meantime. We have over $600,000 that has been carried over, and that is ready to go. And so if people need help, we also have a $1.9 million contract with the Talbert House for rental assistance. And so if people want to get that, they can go to our website now and be able to get that assistance right away. And we wanted to make sure that people know that we have something ready for them right now. In addition to that, we have a cash assistance program. It's called the Prevention Retention Contingency. And what that is, it's a one-time, once-a-year payment up to $3,000 for emergency assistance. And we know that people are in a state of emergency. This is not a poverty service. This is a service to help families who are struggling, because we know people in the middle who don't know where to go for help, never had to get help. This is something that can help them. It's called the PRC. It's called the Prevention Retention Contingency, and it is available to help families right now. You can apply at HCJFS, jfs.org. And that helps people. And we have helped families who made $43,000 and they were eligible. And so this gives us some flexibility to help people because we know and meet people where they are for this type of help. So these are some of the things that we have going right now. But the Economic Recovery Release Task Force continues to push the envelope. We're working hard internally. We're learning from what we've done before and how we can improve. Holly is going to come up and talk about what is being recommended for the additional money. So we've got about $4 million that's still in the pipeline, that still has already been committed to helping people, and we want to make sure that continues to go. But then we have a little over $6 million about what do we do now. We want to do more help for small businesses. We really need to help small businesses continuously. We saw that in the last 2 rounds that we were able to help a lot of small businesses, but there were a lot who really still needed help. So we know that that is a major focus. We also will be looking at how do we get navigators to help small businesses, to help people through the unemployment process, so we can get people out of the bottleneck and get you connected quickly to these resources. So I'm looking forward for her to expound on those issues. So that's what's going on right now with the Hamilton County Economic Recovery Release Task Force. We've hit the ground running, and we have talked to a lot of folks. I want to thank the mayor of Gulf Manor, who we talked with. We'll be meeting with the mayor of Silverton, as well as the mayor and city manager of Lincoln Heights to get input as quick as we can. We also met with KUFA, who gave us input as well. And so you'll be hearing more about that as we're reaching out to make sure that what we're doing is connecting in the community and they're able to help get the help to people in a quicker way. So thank you very much, and I'll turn it back over to Commissioner Driehaus. Thank you.
Thank you, Commissioner. Commissioner Kesterman, the floor is yours.
Good morning, and thank you. So this week, there really has been a lot of trends that are continuing to go in the right direction. This includes decreasing cases, less hospitalizations, and probably most importantly, increased vaccination clinics within our community. Our community continues to be best in the state with regards to access to testing. When looking at the number of people tested week after week, this number has continued to remain consistent. And from my perspective, that's great news. That means our community is doing the right thing. When you feel sick, you're going to get tested, and that means you're staying away from other people and slowing the spread of COVID-19 within our community. So for those of you doing that, I really appreciate it, and I encourage everyone, if you need to get tested, there's a lot of resources here through the Test and Protect program, and those resources are available on our website. So please check out hcph.org for information on testing within Hamilton County. Looking at our data a little closer, our highest peak with COVID-19 was December 10th. We had about 716 cases of COVID-19 per day on average that week. I did add a graphic back from middle of the summer. I put the masking graphic back on this just to show where we were many months ago, and we saw the mountain starting, and then it just declined. And then what we saw over the winter was just a huge, significant increase in cases. I'm proud to report that today we are down around 304 cases per day on average. So we have seen a lot of improvement in our case numbers, and I continue to ask our public to work together to make sure that we're doing the right things to help decrease our COVID footprint here within our community. So to those of you that are working hard on social distancing, wearing your masks, and probably most importantly, keeping sick at home, I truly want to say thank you. I think we have made a big difference here in Hamilton County. There remain about 7,800 active cases of COVID still within our community. So even though things look good today, and I'm going to share a couple other good metrics, I think it's really important to remind yourself that there is still a lot of opportunity to get sick. So please continue to do your best to keep everyone healthy within your family and our community. Our reproductive number today continues to be below 1. Today's number is 0.86, and for the region, we are at 0.85. We have been at this level now for several weeks, which is also promising that we're starting to see some constriction of the virus within our community. Hamilton County hospitalizations, which are represented on the top graph, are about 2 or 3 hospitalizations per day. When you look at the region's hospitalizations, we still see a lot of folks within our hospitals, but the trend has been downward for quite some time now. Our region's hospitals are seeing about 430 patients per day. This is down by 120 over just last week, and for the last several months we were at 800. So we are absolutely pleased to see us finally starting to decrease and significant improvements. Similarly, in our intensive care units, we had over 200 patients within our intensive care units each day. Today, we are at around 120, so this is good news. Now, the one metric that is not so good was highlighted by Commissioner Driehaus, deals with deaths. We know this is a lagging indicator, and we know this that the more hospitalizations we see, we know ultimately will result in more deaths. So having a high number of deaths right now is sad, and it is a result of overall COVID in our community. But the good news is those other metrics are decreasing, and so hopefully we'll see deaths start to decrease pretty quickly as well. Shifting my conversation over to vaccine, there continues to be a lot of great work within our community. There are over 50 providers this week that are providing 21,000 doses of vaccine to those that are 65 years and older, as well as about 11,000 of that going to adults working within school buildings, including teachers and other employees. Next week, Hamilton County will be receiving 14,200 doses of vaccine. This vaccine will go to both our schools and those that are 65 and older. The final phase and portion of phase 1B will also be opening up, and those are for individuals with very specific qualifying medical conditions. These conditions are shown on the screen but are also found on our website, so you must meet one of those very specific criteria. We realize that there are a lot of people that are eligible today that don't have an opportunity to get vaccinated. There's just still not enough vaccine within our community, so if you're eligible now, it does not mean that there will be a dose of vaccine waiting for you. This is a hard reality, but it's the truth. It might take a month or two to get everyone that is now eligible to get vaccinated. So we are continuing to remind folks to be patient as we work with the vaccine and lobby to get more vaccine here in Hamilton County. If you're trying to get vaccinated and you want to get an appointment, the best way to do so is to make sure you're registering on each website and each provider here in Hamilton County. The majority, there's 50 providers I mentioned, but there's about 10 different locations that you have the opportunity to register. So I would ask that you go to each of those websites. They can be found on our webpage, which is hcph.org, and you can make sure that you get an appointment over time. Like I said, it might take a little bit to get there. I think the other good news with vaccine, Commissioner Driehaus shared some of the statistics, but at a high level, Hamilton County has had 79,000 people vaccinated with their first dose of vaccine. This represents nearly 10% of our total population. 90% still to go, but I think 10% is a great start. And we know that those elderly within our community were the first ones to start having access to vaccine, urging people not to pass up their opportunity to get vaccinated. If you're currently eligible to be vaccinated and an opportunity opens up, we ask you to take that opportunity. Please realize that if you pass up that moment in time, it might be a little bit before we get back to you. So it's a very great opportunity to think about it in advance, and when that moment opens up, accept that. And finally, as we continue through and try to get the majority of our population vaccinated, please remember to wear your mask, socially distance, keep sick at home, wash your hands, do all of these things that we know have made a big impact within our community. Thank you very much.
Thank you, Greg. And now Holly is going to expand upon the CARES Act funding. And she's got this great graphic of some of the results of what was done last time. And so it's what we're doing, what we've done, and where we're headed. Thanks, Holly.
Thank you, Commissioner Driehaus. Good afternoon. I'm happy to provide an update on our CARES Act funding that we received last year, in about April of last year. As most of you know, we received $142 million. At the time, we allocated that into 4 buckets, which included public health, vulnerable populations, county operations, and community and economic assistance. And you can see those budgeted amounts on the screen. We spent a lot of time last year working with our partners and standing up new programs, leveraging existing programs, And you can see some of those results are on the screen now. I hope we're proud of these results. As Commissioner Reese mentioned, our rental assistance program has more than 3,000 residents that have been assisted. That's a shining spot for us. And of course, our testing program, as you can see on here, that number continues to change every day. We're now over 43,000 community tests that have been conducted just since September. So we've really expanded the capacity for testing, and as Commissioner Kesterman has, I'm sure, has alluded to in previous briefings, that is such a key and critical component to reducing the spread of COVID-19. We're very proud of that program and the partnership that we've had with the Health Collaborative, as well as all of our hospital systems. A few other programs I'd like to highlight on here. As you can see, we have done school grants to help schools with the increase in costs that they've had for COVID-19 in terms of cleaning costs. We have funded 80 schools or school districts, including our biggest ones, as well as very small schools. And our nonprofits have played such a critical role over this past year, of course, in the social services that they provide and the increase in need and cost that they saw. So we were proud to be a partner with 60 nonprofits plus 3 organizations that focus on domestic violence, providing almost $5 million to those organizations for those increasing costs. You know, I could go on, and if any of you were on the board meeting yesterday, you probably heard a lot about our results. What I'm happy to say is, as you all know, the funding for our CARES Act was scheduled to end on December 30th of 2020. We're very thankful and thankful to our congressional delegation, our Board of County Commissioners, for their help in making sure that an extension was included in the Consolidated Appropriations Act that was passed late last December. That did include an extension of this funding through the end of 2021. This was important for us because, as you know, the need wasn't going to end after December 30th of 2020. We wanted to continue our testing program. We wanted to continue our rental assistance program. Again, we knew that need wouldn't end at the end of the year. So again, I'm grateful to all the help we've had from our elected officials and our delegation to ensure we received that extension. So of the 142 million, we had 132 of that encumbered and or spent by the end of 2020. So roughly 11 million was remaining, and of that we are continuing many programs. Obviously our testing program will continue, our remaining funds in our rental assistance program will continue, but the 4 million that we want to continue as well includes remaining balances in budgets from our CARES Act. And so that includes programs such as continuing to purchase personal protective equipment. We know, again, the need to continue to mask, for gloves, and the need of our partners. So we do want to continue providing that service and purchasing those goods for our community and our community partners. As Commissioner Driehaus mentioned, we also want to continue to provide assistance to Hamilton County Public Health, specifically for vaccination assistance in 2021. We also had a little bit of dollars remaining in our contact tracing line item that we would again like to continue to provide assistance in that regards. We have money in our CARES plan, $500,000 for an alternative care facility. You remember we talked about this a lot last spring about the potential need for that. We are continuing to have a placeholder for that in case there is a need through spring, but we'll revisit it if there's no need and potentially recommend reallocating those dollars. And then you can also see on the screen, we do have a little bit of money remaining in our homeless budget that we would like to reserve and provide for day shelter operations or other costs we may not be aware of that are necessary to help with our residents experiencing homelessness. So with those programs, we still have just a little bit over $6.5 million remaining of the 142. And as both Commissioners Driehaus and Reese mentioned, a few of these programs, the bulk of the 6.65, the county administration is recommending for a third round of small business assistance in the amount of just a little over 4 million. You can see here 4.35 million. I think we can all recognize that many small businesses continue to struggle getting whether it's PPP or other federal assistance. And we would like to continue to step in and help those small businesses that are in particular struggling with whether it's reduced hours, and as well as businesses that just, residents aren't out as much as they normally are. And we want to help those businesses survive through these next several months. We've also are recommending $1 million of the 6.65 for emergency food and food assistance. We have heard from the Free Store Food Bank that they are projecting an additional almost $200,000 per month in food costs just for Hamilton County. We want to provide, or recommending to provide a stronger partnership in that regards. In 2020, we did provide some funding for food through our nonprofit grants, but believe due to the increased demand, this is an opportunity we have to step up. The third option that we're recommending is the county's phone system. I know this might seem a bit odd, but given the remote workforce needs that we have, our phone system is just not working for our employees. We can't do call forwarding. We can't, and most importantly, Hamilton County Public Health, as you can imagine, has had a huge increase in the number of calls to their phone lines. Their bandwidth is being stretched to the limit. And the last phone system we want to go down is our public health phone system. So we looked at upgrading just public health, but realized the way our system is set up, we can't upgrade public health without upgrading the entire system. And so we are recommending $800,000 to provide for that upgrade. This was included in our original CARES plan last year. However, we pulled it late fall because it wouldn't be done before the end of the year, and we weren't guaranteed an extension at that time by the federal government. And the fourth program Commissioner Reese mentioned is a system to really help residents and businesses navigate the number of programs that are out there and available for them to access. We know there are businesses as well as residents who maybe have never asked for assistance before, maybe don't know where to turn for help or how to access the assistance or what the requirements are or what documentation may be needed. And in addition, there are new programs available that residents may not be aware of. So we would like to allocate some portion of our remaining balance to provide more of a customer-focused and customer-centric assistance program to really, again, help our residents and businesses figure out the best assistance program for them, how it works, and how they can connect to those assistance programs. I think that's about it for our recommendations. Again, I want to thank the team and all of our partners. I think we had a great 2020. All things considered, there were some silver linings, and I just want to thank as well all of our partners that helped us help our community at such a terrifying time over the past year.
Thank you, Holly. And I too want to thank the team for the 24/7 effort that you guys put into distributing those dollars. Bridget, with that, I think we're ready for questions.
Thank you, Commissioner. Up first, Courtney Francisco from WCPO. She has questions for Commissioner Kesterman.
Hello. So I received this Interact for Health survey, and it shows 90% of people in our region wear masks, 96% wash their hands, and the group asked these questions back in October and November. So do you think those numbers are fairly representative of everyone's habits today?
Actually, those are good statistics showing that our population has done what we have asked. And I've been saying throughout this pandemic that I've been really proud of Hamilton County residents. I think we as a community have come together and stepped up where we needed to.
Okay.
Thank you, Courtney. Next up, we have Corey Sharber from WVXU, and he has questions for both Commissioners Kesterman and Reese.
Good morning.
Good morning. So yeah, I guess we'll start with you, Greg. Just want to talk about the new deaths that have been reported. It's pretty alarming, going from 5 to 27 in just the past week. Do you have any indication of when those people were infected or hospitalized? Because, this is an awful lot of deaths at one time.
No, I don't. Often what happens is people progress through the illness. So folks, once they get sick, it takes typically a couple weeks for somebody to end up into the hospital. And then once hospitalized, sometimes it takes a week or two before they progress enough to end up in the intensive care unit. Our hospitals have done a great job and learned many new techniques to help keep people healthy and out of the intensive care unit. But unfortunately, by the time you get to the intensive care unit today, you're pretty sick. And the majority of those individuals are on ventilators, which is about as bad as you can get with COVID-19. And so ultimately, a portion of those will pass away. So the onset of illness has really been probably over many, many weeks, and potentially even over a month or two.
Also wanted to talk about how hospitalizations within the county's hospitals and within the region have been going down, but I'm assuming there's still a lot of strain within them. Could you go more in depth about the strain hospitals are going through right now?
Actually, at this point, our hospitals still are overburdened, but as a whole, they are feeling much better than they did about a month ago. You can notice from the numbers, we are in many respects about half as high and half as full as we were 1 month ago. So this trend has really helped our hospital systems get back to a little bit more normal of a staffing position. They're not perfect yet. There still is a lot of strain within our systems. There are other illnesses that they still need to treat, but we are absolutely heading in the right direction.
And next week, Phase 1B, sorry, I have just one more for you, Greg. Phase 1B starts next week. The county will be receiving over 14,000 new doses. Could we be seeing new vaccine sites in the next couple of weeks?
So what we do know is that Hamilton County and in the state of Ohio, we will be activating Kroger's and Rite Aid through the federal program. I believe there may be 1 or 2 new sites throughout Hamilton County as a result of that. And there may be an additional federally qualified health center that gets opened up, but there are no major plans to open up significant providers until there's more vaccine available here in Hamilton County.
Okay, that was my last question for you, Greg. Thank you. So I have one for Vice President Reeves. Hey, I just wanted to ask about just one question about the task force. Since we first started hearing about this over the past couple of weeks, you keep mentioning that we're competing with 87 different counties in the state, and I was just wondering, like, why is it such a competition? Like, does that imply that there are simply not enough resources to help all of the counties right now, or does that imply that we could end up getting cut out of some aid?
Yeah, so background coming from being on city council as the vice chair of finance and then being on the finance committee at the state, whenever they're dealing with a budget now, and it's always, you never have enough resources for everything that you want to do. So, the governor's put together his budget. In Washington, they'll be, putting together their budget. And so what typically happens is those who are ready to go, they have an opportunity to make their case. Now, it doesn't mean that resources won't go to all 88 counties, but we certainly have some needs. And so we want to make sure that we are included. For example, on a policy component right now, the way that we're set up with how we do our sewer system right now, there's a law that does not allow us. We want to. The first thing I did when I came in, I said, why can't we give a break on the sewer part of the bill? And I know that others have asked that question before. So the first thing that happened was, well, state law does not allow us to do that. So we need a state law change. So the one of the things that we'll be working on is recommending that to the board, and then working with our counterparts. But not to just get a new bill, because at the State House, you get a bill, they don't have to even hear it for 2 years, right? We've got a budget right now. We'd like to see an amendment in the budget because the budget has a timeline. So that affects us economically. That would help so many people to give us an opportunity to be able to help people with the largest part of their water bill, which is the sewer component. But we can't do it because we need the state. So that's why it's good to say, hey, governor, and I've reached out to the governor already, and we'll continue to reach out. That's what our goal is, to be an advocate, but to say, hey, we need something right now. So the task force goal is to come with a right now emergency and see what are other ways that maybe we got denied some years ago, but we didn't have COVID years ago. We're wearing masks now. We're doing things differently now. So we now may have to go back, and we have to go back in a time when they're doing the budget and say that, Hamilton County, and then I'll say, I'm biased toward Hamilton County, obviously. So on the finance committee, we always had to fight to say we better get our fair share. Everything goes from Columbus on up north because Columbus is there every day and all the way up north. And we always have to fight and scrape to say, wait a minute, we've got to get something down here at the southern part of the state. So the task force allows us, I think we're one of the only, I don't know, I haven't heard of any other, we're out front now. We have this together now. So we're trying to stay out front so that we can bring resources and then be at the table when they're making these decisions as well. So I'm excited about it. But that's what I mean when, there's going to be limited resources everywhere. Everyone has a need. So who's going to be, fighting the hardest and the squeaky wheel gets the oil and stay right at it. And that's what this task force is going to do. We're going to stay right at it. We're going to be saying we need to be at the table. We have a plan. We have needs. And that is what our job is. And that's what the Economic Task Force, Relief and Recovery Task Force will be doing.
That takes care of all my questions. Thank you very much.
Thanks, Corey. Mark Wart with the Inquirer has questions for Commissioner Kesterman.
Good morning, Mark.
Good morning, Greg. How are you? My questions mention how there are 10 doors, in essence, you should be knocking on to get a vaccine. We have a contact form for readers, and one of the complaints we have to knock on so many doors. Is there any way to streamline this? Is there any way to make this easier so that that's a one stop? I know that there's been some discussion that the state's portal is going to be changing, and if that will make it easier. I don't know what's on the horizon, but what thoughts or comments can you add to that?
So I do appreciate the question, and I couldn't agree more. It is difficult to navigate 10 different systems. We here in Hamilton County have created a few tools that help, but they're not still perfect tools. The first is I've shared our webpage. I think it's a great resource. It shows map locations for testing sites. We often share the webpage Test and Protect Cincy with a y.com. That webpage shows every site as well in Hamilton County. It offers you an opportunity to register to get notifications when future updates occur. And then lastly, working closely with the county commissioners and the United Way, we have created 211, which is a tool for those that aren't good with the internet to call and help navigate the system. Now, these three tools only help provide access to knowing which sites have vaccine. And you're correct, it still requires a lot of effort. It still requires each individual to call many systems, and it takes time, and often it's frustrating because when you call, there are no appointments available. So the state of Ohio is working on a registration system. At this time, it's not available yet, and it is optional. So here we will advocate that many partners jump on board. It will only be a valuable system here in Hamilton County if the majority of partners step up and decide to participate in this system. The difficulty will remain is that we are now in week 6 of our vaccination campaigns, and every provider has created a system that ties to the electronic medical record. It tells patients when they have to come back. So switching systems mid-campaign can be complex, and it's not an easy solution, but we will work hard to continue to try and create access to all populations.
Okay, the second one is, I know you said before that the state's out looking for variants. I'm assuming they're letting locals know if they're out and about locally. So do we have any reconnaissance about variants in Hamilton County?
The state of Ohio is actively working and looking for those and has not yet found any in Ohio. I've heard several conversations, including our medical director for Hamilton County Public Health, Dr. Fagan, say it's not a matter of if we get a variant, it's a matter of when we get a variant. The good news is that the tools that I keep sharing and have been sharing for a long time now, the socially distanced, the wear your mask, wash your hands, keep sick at home, those are the tools that will continue to help protect us while we get enough of the population vaccinated and learn more about these variants.
Okay, and last one, I know that you were at one point you were having to hire contact tracers because there were so many cases, and I know that other counties just kind of gave up. How is contact tracing going right now? What's the stress level on that system?
You know, I am proud of our team. We have, throughout this pandemic, done an amazing job contact tracing. There have been some pretty rough days where we wake up and we see the highest number of cases we've seen. But my team, we have pushed through. We have added, we still have over 100 contact tracers and outbreak specialists working with us. And ironically, the good news is right now our cases are down, which means they're not as busy as they once were. But at the same time, I am trying to reach a really hard demographic and talk them into coming and getting a vaccine from one of our clinic appointments. So what we're using our contact tracers now for, calling those seniors that are now eligible and scheduling their appointments. And the happy part of this story is, you know, contact tracing is hard work. It's a phone call, which might seem easy, but not everybody is excited to talk to you. But when you're calling a senior and offering them an appointment to get vaccinated, they're the most thankful and happy group that there is. And so this has been really happy work for my team, and we're happy that we've been able to share the work between what they had been doing and what we're now able to have them start doing.
Thank you,
Mark.
Greg.
Absolutely. Thank you.
Next up, we have Ashley Kirkland with WLWT. Ashley, who would you like to direct your question to?
This could either be to Kesterman or Commissioner Driehaus. This is about the rescheduling of vaccine appointments that were canceled yesterday because of the weather. Do you have a plan for that, or what should people know?
Absolutely. So yesterday morning at about 5 a.m., members of my team were talking and making decisions about what to do. And looking out the window, just like everyone in Cincinnati, we were surprised to see between 6 and 13 inches of snow, depending on where you lived. We realized that our clinics ran from 8:30 in the morning until about noon. We were going to see about 450 patients, many of which were receiving their second shots, many of which were senior citizens. And we decided asking them to drive at 8 in the morning in the middle of a level 2 snow emergency was not the right decision. I'm proud of my team once again. We have folks that are better at technology than myself. And by 7:30 a.m., everybody who had an appointment received an update through the application that we're using, as well as an email. And by about 8:30 in the morning, everybody received a phone call from an automated system that told them that their appointment was canceled and a new appointment had been scheduled. And every single person has another appointment scheduled for either Friday or Monday. So really quick response on my team. Every single person is still getting vaccinated, and couldn't ask for a better plan to play out for us.
Another question. Have you guys, I know there's a shortage of vaccines. Has there been any directive from the state or the Biden administration about the influx of vaccines that was proposed to get 100 million vaccines in the first 100 days of that administration?
So there are varying tools that are being implemented right now. I shared the piece about Ohio receiving direct shipments from vaccines straight to our pharmacies. Now that's a small increase. That's only 30 to 40,000 here in Hamilton County. But there are also other things that are happening. So as we finish up our schools, the state will be able to use all of those vaccines directly for those in our phase 1B allocation. And then additional manufacturers are creating the Pfizer and Moderna vaccine, meaning they have shifted what they're producing within their facilities to help increase vaccine here in the United States.
Thank you.
Next up, we have Chris Wederick with the Business Courier. Chris, who would you like to direct your question to?
Let's try Holly at first, and I think she'll probably be able to answer this. The leftover CARES Act money that's going to go to small businesses, are there going to be new standards for that, or is it kind of going to be under the
Great question.
the
Thank
old
you.
program? And can you talk a little bit more about?
Did you break up?
I'm sorry, I'm still here. Could you hear me there? I think we had a problem.
Yeah, I think I understood your question, Chris. It broke up a little bit, so if I don't answer, please redirect. Yes, so the $4.35 million that we are recommending for small business assistance, we are have not finalized the criteria or eligibility yet. We are taking a look at our previous 2 rounds that we provided, as well as the program that the state provided late last year, to see if there are ways to improve the process, as well as streamline things, and of course, want to have input input from the board on any particular criteria they would like to see. So more to come, and more to come pretty quickly.
Just to make sure I understood, on the previous two rounds, was that money completely dispersed, and was there anybody left on the list or who applied who was not able to get any allocation from the first couple of rounds?
Okay, yes, the first two rounds, the first round we funded 217 businesses. The second round we funded, I think it was right around 562. We had the opportunity to have a lottery if need be. We did not need to use the lottery for either round. So any business that met our eligibility criteria was able to receive funding. We did budget $7 million for that program, and including administrative costs that we had with our partner HCDC, about 6.9 was actually provided for that entire small business program. So the remaining roughly a few hundred to 600,000 is being redirected into these new program recommendations.
You said 6.9 of the 7 million was distributed. Is that correct?
7.5 that was budgeted.
Oh, okay. I'm sorry. All right, great. Thank you, Holly.
You're welcome.
Okay, that appears to conclude our questions from reporters.
Great. Thank you. Thank you to everyone for being here this morning. I want to just circle back real quick to this confusion about getting a vaccine. We know there's a lot of frustration in the community as people continue to try to call to get signed up for a vaccine. But the method by which we're getting the vaccine, it's going to hospital systems, it's going to pharmacies, it's going to public health at the city, it's going to public health at the county. And so as you can see, it's not going to one entity where we could have a common sign up, common space, distribution. That is not how it's going in Ohio. That's not how it's been set up by the governor. And so we have different portals for folks to get signed up. It is confusing. Our Test and Protect Cincy with a Y, .com is not perfect, but at least it's a common place where you can go and see who the providers are, get the contact information, and then go and try to get those appointments with the different entities. 211 is fantastic, and they will walk you through the process. So while it's not perfect and it continues to be confusing, we are hoping that some of the things that we've put in place have made it just a little bit easier for people. And as Greg said, as the doses loosen up, we get more doses, but also the doses loosen up for the folks that are eligible, and the teachers get vaccinated. We start to check the box for some of these other folks that will loosen up doses for everybody else. And so it will start to get better. It's gradual, but it will start to get better here within the next few weeks. So thank you, Greg, Holly, Alicia, everybody for being here, and thank you all for joining.